Welcome to Doctors on Call. I'm Jenna Miller. Arthritis means inflammation or swelling of one or more joints. There are many types of arthritis and each has different causes and treatments. Specific symptoms vary depending on the type of arthritis, but usually include joint pain and stiffness. The main goals of arthritis treatments are to reduce symptoms and improve quality of life. Fortunately, current treatments allow most people with arthritis to lead active and productive lives. We'll discuss these issues and more on Doctors on Call with our physician guest, family physician, Dr. Ferrill Conant.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Ferrill Conant is a dedicated family practitioner with over 3 decades of experience serving the community at Smith County Family Practice. Dr. Conant attended Mid-America Nazarene University and graduated from the KU School of Pharmacy. He then attended the Kansas University School of Medicine and completed his residency at Wesley Medical Center in Wichita. Dr. Conant has been in the Smith Center medical community since 1989. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us again this year. We're happy to have you back, and we're going to jump right in so we can tackle this topic.
All right.
First of all, let's talk about the most common types of arthritis, the osteoarthritis and rheumatoid arthritis. Can you explain the difference?
Yes, thank you. Those are two broad, but I think fairly accurate ways to group arthritis. Osteoarthritis affects any joint. Usually we think of it in the weight-bearing joints, the hip, the knee, and the ankle. Rheumatoid arthritis can affect any joints, and it actually usually is the small joints of the hand is how it begins, but eventually it can affect any joint. And we'll talk a little more about that maybe, but rheumatoid arthritis is a type of inflammatory arthritis, although osteoarthritis does carry with it some inflammation, itis meaning inflammation. So they both share that in common, but there's some differences in their mechanism of how they damage joints and how they affect people.
Is there one that's a little more dangerous, for lack of a better term, than the other?
In some ways, I think of rheumatoid arthritis being potentially more dangerous because it's a type of arthritis where the body actually begins to recognize its own tissue as foreign. So we call it an autoimmune disorder. The body actually begins to attack its own tissue. So that carries with it potential effects on a lot of organ systems. Osteoarthritis, on the other hand, really just stays pretty well limited to the joints. But rheumatoid can affect the small intestine, even the eye, can affect the heart. So in that sense, I'd say rheumatoid has potentially more serious consequences.
Sure. Now, does genetics play a role in this? Is it lifestyle? Can we, prevent any of this from happening?
I think all of the above apply. There is some genetic component to probably both rheumatoid, inflammatory, and osteoarthritis. Lifestyle affects either type because it is damage to joints. If our joints are stressed more by maybe unhealthy lifestyle like bending, lifting practices, our body has a limit. And if we strain it too much, we can certainly damage it. Overweight likely plays a role in both cases because that just puts more load on our joints and potentially more damage.
Sure, absolutely. So we've talked a little bit about this. Let's dive a little deeper into some of the signs and symptoms of arthritis. What are some red flags?
Yes. So pain is the symptom that brings almost anyone to the doctor, pain. And it's pain that can have varying, it can act in the case of rheumatoid arthritis, we think of it being pain that is worse in the morning, we call it morning stiffness, that can be a characteristic symptom of rheumatoid arthritis. Pain in those joints on a rising that lasts an hour or more, stiffness of the joints, lack of mobility. Osteoarthritis causes pain too. Interestingly, the osteoarthritis pain often is relieved by taking weight off the affected joint. Again, speaking of those weight-bearing joints more commonly affected by osteoarthritis, the knee, the hip, and the spine.
Sure. How is a person diagnosed?
First of all, by just talking to them about their symptoms, duration, how long it's been with them. If there are other family members that have, in the example of rheumatoid arthritis, there is a genetic component there. So if their mother, their father had rheumatoid arthritis, that kind of raises some red flags that we need to consider that as a possibility. Testing for various types of arthritis can involve imaging like x-rays. It certainly can involve blood tests. Those are helpful. Sometimes they're helpful because they tell us it is not a certain thing, but it may actually rule in a diagnosis like rheumatoid arthritis if everything fits, and then specific blood tests that should be abnormal are abnormal, and then we can say this looks like rheumatoid arthritis.
Sure. Now that's interesting to me, how a blood test can actually diagnose something like that. Explain that.
Yeah. Well, and again, speaking specifically of rheumatoid arthritis, there's not a blood test that diagnoses osteoarthritis. It's more physical exam, symptoms, maybe joint appearance on x-ray, but rheumatoid arthritis does have blood markers. For example, the rheumatoid factor, cyclic citrullonated peptide antibody, CCP, those are fairly specific, again, if the symptom constellation and the physical exam is consistent and those blood tests are positive, that's what it is.
Interesting. At what point should a patient, think, maybe I need to go see my doctor about this?
Right. I think most folks come to us when their daily activities are inhibited. They can't do what they enjoy. It hurts. They've tried maybe some treatment without maybe much benefit. So it's usually driven by, doctor, I can't do what I want to do because I'm in pain. Pain is almost always the driving symptom that brings them to our attention.
Sure. Now, we talked about genetics. Just because, mother, father, grandparents, great-grandparents maybe had arthritis, is that an indication that you will, or is there anything that you need to be a little more aware of?
Well, in some cases it may be. Again, there's a genetic influence, but it isn't a foregone conclusion that, a family member that may have rheumatoid arthritis doesn't mean that every sibling, every offspring will get that. There's just a lot of variability in our bodies. Osteoarthritis, again, I don't think of it very much as a genetic influenced disease. More, again, the effects of overweight, smoking. I always like to find a good reason to tell people smoking is bad because it is, but it can affect the body's ability to restore itself with damaged joints or inflamed joints. So those lifestyle choices need to be addressed too.
Sure. Let's talk a little bit more about the smoking, because we've had other doctors that have also, really encouraged their patients or the viewers to stop smoking. Why is it so bad?
Well, that's just one reason. I mean, the list of ill effects from smoking is long. I mean, obviously the things that we think of, like increased risk of vascular diseases, stroke, heart attack, peripheral vascular disease, blockage in arteries to take blood flow to the legs, emphysema, COPD, lung cancer, bladder cancer, osteoporosis. There are more that are not popping into my head right now, but there's just a long list of unhealthy things that accompany smoking. So if we can kind of encourage those that don't smoke, don't start. Those that do smoke, we do try to encourage them to quit and try to find methods and ways to help them.
Okay.
There's just so many benefits.
Absolutely. And before we move on, what kind of methods would you suggest?
All right. Truly, what has been successful, as has been reported to me by patients over my career, is, we'll have a discussion about smoking and talk about things. maybe we have a follow-up discussion and they say, hey, I quit smoking. And I always ask, well, what did you do? The majority just quit. They just quit cold turkey. Now we offer things like nicotine replacement in the form of transdermal patches for that purpose. Chewing gum, nicotine gum, maybe not as effective. There are 2 or 3 medicines that may help curb the desire to smoke. So we talk about those and offer them. The key is trying to get the patient to put it in their mind and start thinking about it. And we try to give them good reasons. You want to be around, for your family. Do you want to spend less money on cigarettes? All of those factors, if they motivate patients, we're going to use them all. We think it's fair.
Absolutely. And that brings up an interesting point. Is it sometimes which can be very difficult, don't get me wrong, but is it sometimes a mind over matter type of thing?
Yeah. And we know that nicotine, the chemical in cigarettes, has a receptor in the brain that when that brain receptor is absent nicotine, it's crying out for it. So there is an addictive component to it, nicotine addiction. So it is mind over matter because our brain is telling us if we smoke and we're not smoking, where are cigarettes? Where is my nicotine source? Okay. But people who quit, they just often make up their mind, and then they're probably a little tough to be around for a few weeks, but that's okay too.
So everyone needs to be a little patient.
Yeah, right.
Absolutely.
Right.
Okay, well, we want to remind our viewers that we are talking tonight with Dr. Ferrill Conant of Smith County Memorial Hospital. We are discussing arthritis, even though we took a little pause on that, and we're discussing the benefits of quitting smoking. So give us a call if you have a question about arthritis or any other symptom that you might be having. Our phone number is 800-337-4788. Okay, back to arthritis. Mm-hmm. Let's talk about the remedies and treatments that are available for that specifically.
Right. Either type of arthritis, whether it be osteoarthritis or rheumatoid arthritis, and there are subgroups in both of those types of arthritis. I try to be simple about offering treatment. Over-the-counter medicines may be effective. Even Tylenol is a good medicine. It has a good safety record when it's used in the appropriate dose, and we don't add other sources of Tylenol that do kind of hide in a lot of over-the-counter medicines. That can be a risk of getting too much Tylenol because we don't read our labels and we take medicines with Tylenol. But Tylenol is very good for some people. For some people it doesn't work. There is a large group of medicines called the non-steroidal anti-inflammatory drugs, NSAIDs for short. Many of them are over-the-counter now, and that includes Aleve or naproxen, ibuprofen, Advil is a brand name, Motrin's a brand name. Those can be useful. They all have potential side effects. There are, in that group of NSAIDs, there's plenty of prescription choices. It's usually a matter of looking at the patient's history, maybe looking at other meds that they take, making sure that they don't have a contraindication to any of those medicines based on maybe poor kidney function or a liver disease. Then we have to rethink our process and make our decision a little different. But those medicines can work for some people. Again, they have risks, so we have to talk to them about those risks. With NSAIDs, bleeding is a risk. Stomach bleeding, intestinal bleeding. Our nephrology docs and heart docs are not as much a fan of them because they can potentially affect the heart and the kidney. Boy, for us family docs, they work really well. So if we use them in the lowest effective dose and try to even have breaks between dosing, if patients can take them intermittently, not every day, but every other day or every third day, that can be a good thing, a good strategy too.
Sure. Now let's talk about the prescription meds that a person can use.
Right. So there are a variety of those. Mainly the group that I think of are the NSAIDs because of their anti-inflammatory pain-relieving properties. We try to avoid opioids or narcotic medicines. They're just not ideal for this pain because it is a chronic pain and we know there's a risk for opioid addiction. So we try to steer clear of those if it's possible. There are circumstances where short-term strong narcotic or opioid medicines may be appropriate, but we try to minimize that.
Absolutely. Now, you had mentioned Tylenol and ibuprofen. I know sometimes in the past it seems like they were, doctors would say take one and then a couple hours later you can take the other. But I've heard that you can take them at the same time and it's just as effective.
It is possible
how do you feel about that?
It is possible to do that. Again, if you don't exceed the dose that is safe, and hopefully we're talking to our patients about what's the proper dose. They can be taken at the same time.
Absolutely. Yeah. What about topical creams or ointments? How effective are those?
It depends. I believe in mild osteoarthritis, topical treatments, which include diclofenac, ketoprofen, those are topical anti-inflammatory NSAIDs, so they're rubbed on the joint, the affected joints, 2 to 4 times a day. They can relieve pain, and they have less absorption through the skin into the system, therefore have a theoretical and probably a real safety advantage. They can be effective, but only I think in mild cases. There's another topical cream called capsaicin that's been around for a long time. It's also safe, may be effective in mild cases.
Absolutely. Well, we have a phone call waiting, a caller waiting to ask a question, so we're going to go to the phone lines. This is Lana on the line from Russell. Hi, Lana. Go ahead with your question for Dr. Conant tonight.
Hi, my grandma was told that she had arthritis in her hands, but the good news was that it wasn't crippling arthritis. Could you explain the difference to me, please?
Sure. So when we speak of the word crippling arthritis, that means rheumatoid arthritis, and it often affects those small joints of the hand, usually these joints, what we call the metacarpophalangeal joints and the proximal interphalangeal joints. Rheumatoid arthritis, again, being that progressive, destructive to the joint arthritis, can cripple because it deforms joints and makes them not work. So she doesn't apparently have rheumatoid arthritis, probably has osteoarthritis, which also hurts, but is less likely to be a disease that's going to cause her hands to no longer function.
Sure. Now, is there something that this person can do to try to keep the crippling at a minimum, or is it just it is what it is?
I think it's just you know what your limits are, and then you have to treat your joints right, whether it be the hands, whether it be the knee or the hip or the spine. Treat your joints nice. Absolutely.
Speaking of treating your joints nice, let's talk about exercise. How important is exercise? Can it help ease the pain? What's your take?
Yeah, it is a good idea. You know, aerobic exercise is always beneficial, not only for our joints, but for our body in general, for our heart, for our lungs, our cardiovascular system. We prefer what we'd call low-impact aerobic exercise. Running, jumping, probably not very good if you have painful knees and hips, and most people won't do that because it hurts. But motion is critical. If joints don't move, they stiffen and become less and less useful. So if hydrotherapy, pool therapy is available, that's great because it takes the weight of our body off joints, and then we can have that motion to relieve pain and inflammation and keep function good, keep our strength where it should be.
Sure. Now, sometimes you'll hear of like your more natural takes, I guess, glucosamine and whatnot, that sometimes can oil the joints. Yeah. How do you feel about that?
You know, when I speak to patients about that, that comes up fairly frequently. I'm not sure that there's strong evidence of benefit. On the other hand, I think those are safe. So the discussion I'll usually have with patients is, yeah, if you would like to try glucosamine chondroitin in combination, give it a good try, maybe up to 6 weeks. Take it as according to the label, and then you can decide, do I think I'm doing better with it as opposed to when I was not taking it? And if they can't clearly say that, I think it's reasonable to stop the medicine. And then maybe they'll find, hey, it was helping. And that's true of a lot of medicines we use. Sometimes we're not sure they're helping. We stop and we think, it was helping. So I'm okay with glucosamine chondroitin if it's beneficial. I don't believe it has strong efficacy or effectiveness, but I'm okay with patients trying it because of its safety.
Sure. And so there are no, side effects?
I don't believe there are. And that is why it's available without prescription, over the counter. Many people just pick it up and say, I'm going to try this. It says it's good for my joints.
Okay. What about cortisone shots?
All right. Cortisone shots are, I think of them most commonly being used in the major weight-bearing joints, especially the knee. And I do lots of cortisone injections in arthritic knees. Cortisone is an anti-inflammatory medicine. It has a benefit in some cases. It doesn't reverse arthritis. It doesn't cure arthritis. It may alleviate pain and stiffness and swelling. And so it has a place. And of course, we have to use good technique, and we do that a lot.
Sure.
So it has a place.
Yeah, absolutely. And how does it work?
Yeah, so cortisone, we use methylprednisolone. There's several of those, but it is anti-inflammatory. So it's placed inside the joint. The joint's enclosed by a membrane, a cell membrane called the synovium. And so that encases the fluid that lubricates the joint. Cortisone is anti-inflammatory because there's inflammation going on inside the joint that causes pain and swelling. If there's a whole bunch of fluid in a knee joint, for example, I try to remove that fluid and then place the cortisone. And truly, I've found that it seems to work well in about a third of patients. It works okay in about a third of patients. It doesn't work in another third. And I have that conversation with patients. I say, we won't know if we don't try it, and then you can help me decide, is it worth doing it again if it gives you relief? And those can be given probably at least 3 months apart.
Okay. I was going to ask how long a shot typically lasts.
Yeah, and if it lasts longer, all the better. We'll delay it.
Sure.
But it doesn't reverse arthritis. In many cases, and I'm thinking of the knee specifically, it may delay the necessity for joint replacement because it helps patients get by a little longer until that becomes a probable necessity.
Absolutely. Yeah. Let's talk about food and what might a person with arthritis need to avoid.
Yeah. You know, I've talked to some patients about that. I don't believe I know of strong evidence that the type of food that we eat is going to damage our joints. You read about inflammatory diets and non-inflammatory diets. I'm not convinced yet that that'll make a big difference. I'll be glad to be proven wrong. I believe that the quantity of food that leads to overweight and obesity is probably more important, and I think has more evidence that if we can limit calories, if we're carrying too much weight, well, it makes sense. If I lose a little weight, that'll be easier on my joints.
Absolutely. Have you treated arthritis in juveniles?
You know, only rarely, because I think that's an area of specialty, and we would almost always refer those to a pediatric rheumatology specialist.
Absolutely. And what are some factors that may determine eligibility for surgery?
Yeah, okay. That's a really good question. Well, a lot of that decision-making, I believe, is patient-driven. We'll try a variety of treatments, medicines, maybe articular or joint injections, physical therapy. Try all of those. If they become ineffective, then it's probably time to have a discussion with an orthopedic specialist about what are my options. And then that's where various imaging types can be used, whether it be just plain film x-ray, possibly MRI of the joint, and then that'll help in that process. But it's usually patients come to a conclusion that I've tried this, I've tried that, I'm still miserable, I can't tolerate it anymore, and it's probably time to think about joint replacement, because there's great advance in joint replacement and techniques, surgical techniques, and the equipment, the materials, fitting the joint based on CT guidance makes it, used to be that it was sort of like a one shoe for everybody. Now it's very individualized. So I think that does often lead to better outcomes with joint replacement.
Sure. And you mentioned physical therapy. How often do you refer your patients onto physical therapy?
Frequently, because it's an added modality just to try to, along with what they do at home, keeping their joints moving, physical therapy just does some good things about, they help judge by watching the patient move. Are you doing things daily that you're not aware of that may be damaging your joints or making this worse? so they can put their skills to work there to help patients.
Absolutely. Well, we want to thank our guest, Dr. Ferrill Conant of Smith County Memorial Hospital, for being our guest tonight on Doctors on Call. On our next Doctors on Call, we'll be discussing pulmonology and a new technique to discuss lung cancer. You can email questions to us. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.